Hi, and welcome to Appen Media's Georgia Politics Podcast. I am Lindsay Coats, and today I am joined by Beth Fuller, candidate for State House District 53. She has spent her career in public health and most notably at the CDC before she got doged. And we'll talk about her family life, her career, and what's led her down this path to being a policymaking leadership position, hopefully. Welcome, Beth.
Oh, thank you so much, Lindsay. Glad to be here.
All right. First things first. Favorite dinosaur.
My kid really likes the T-Rex, so that's my favorite dinosaur right now.
Okay. All
He
right.
likes the tiny little hands.
That's right. Those little bitty ones right out there. You grew up in Atlanta. Your parents went to Emory, and now you're raising your own boys in Sandy Springs, and that's a lot of Georgia roots, which I'm familiar with as well. But what does that mean to you, being from here, being around this area? Talk to me about like kind of growing up in this area and then choosing to stay here.
There's not, I mean, that saying there's nothing like home. That's so true. After I really wasn't ready to leave home for college. I just wasn't ready yet. So I stayed really close to home at Emory, stayed in the neighborhood I grew up in. And then as I got older, I took some risks and went to grad school in different places. But then when it was time to have kids, I knew exactly where I wanted to go. I wanted to go back home. I wanted to raise my kids in the state where I grew up. And there's something so comforting about it when you get to an area that, like, I recognize the trees, I recognize the streets, I recognize the windy roads, and it just brings me peace. And so it was really clear to me that I wanted to be home raising my kids, and I wanted to be near my parents and my cousins and all these things. So I have an explorer part of me, and then I also have a part that just wants that kind of comfort of being where you are known and you know people
That
and the roots are deep.
familiarity.
Yeah.
Yeah,
Yeah.
just feels like home. So,
Mhm.
talk to me about your family. Your husband, John, you've got two boys. What does life
Mhm.
look like in the Fuller household for you guys?
It's a little bit crazy. First of all, my husband and I, this is our second marriage for both of us.
Okay.
We went to actually, we've known each other since we were 4. We went to a little school on my street in Druid Hills called the Out of Door School, and because it was
Y'all
out of
went to the same school?
yes, at 4-year-old, like 4-year-old
Okay.
school. Yeah.
Okay.
Um, so we knew each other since we were tiny and went to the same high school. And then we went off to different colleges, went separate ways, went to different grad schools, went separate ways. Both got married. Both ended up, those marriages weren't the right fit. And so we reconnected. Um, I mean, it's been 11 years now. So we got married 11 years ago.
That's
Um, but it's another thing that, like, I have known him since he was 4. So
yeah.
I think, people grow and they have their different experiences and they change, but when you know people growing up, you know who they are. You know what I mean? So that was
Yeah.
the extra level of kind of comfort for me. And
Another more
he's
familiarity.
yes, he's such a great guy.
That's
Um, so he's a really good partner.
And then your two boys. Talk to me. How old are they? And what are they just running you wild right now with sports, or are they into what are they into?
Um, so yeah, they're 2 very different kids. Timothy is my oldest. He is in Riverwood. He's at Riverwood, and he is 16, and so he is experiencing the joy of freedom and independence of driving himself,
Was he
around.
excited about that? Like
Oh,
wanted it right away?
I
Okay.
mean, he didn't get it right away because I wanted him to do the driver's ed and, all the things that go with it, and it took him a
Safety.
little while to kinda get it together, but and then he worked at Smoothie King to make some money,
Yep.
because I wanted him to,
Yeah.
contribute to this. So he saved some money, and then we all kind of pitched in, and he went to CarMax, and he picked out a car, and they put a big bow on it, and I've never seen, I mean, he is glowing, he's so happy,
Yeah.
um, and, he's ready for a little independence, so it feels, he drives himself to the gym, he drives himself to he has this trail near our house that he likes to go running in, so, he get like, he goes fishing, so I think he just, he's like, "Mom, I love you, but the time of our lives where you drive me around, that's come to an end. Yeah.
Space.
Yeah. I need a little space.
As is time. And your other son?
So Amir, he is 9, and he kind of came to us in a magical way. We weren't planning on Amir, but we fostered him during COVID,
Okay.
and they had always planned that he would go to his biological family, so we thought it was a temporary thing, but it was really rough finding the right match for him. So after 2 years of fostering him, we said, "Hey, it looks like the biological family, I know y'all have tried, but he really needs a permanent home. So can we adopt him?" And we went through an entire process of that. It's very, I don't know, for anyone that's done it, it's not easy, to go
Oh,
through this. So we went through this whole process, and then we adopted him. And when he was 5, and he's 9 now,
yeah.
and something that was really, really sweet is, my dad had been a Superior Court judge, and he was in retirement, but he came out of retirement to do the adoption.
Oh, how
So, isn't that so
lovely.
sweet? So his last act as a judge was to,
Oh, wow.
finalize Amir's adoption.
Oh, that
So
gave me chill bumps. That's
I
really
know, it was
cool.
so sweet. So, that
What a great
is
experience to
yeah,
add to your family.
yeah.
Yeah, that's really, really cool. You went to Emory, like I mentioned before, like your parents before you. What
Mhm.
did you study? Did you always know you were going to get into public health? Like, how did you find that path?
I studied political science, because I grew up with a political family, and it was just so interesting to me. Like, how do you structure society, and how do we make these trade-offs so that we all can live together? And, I went through my stage in Emory. I took American communism, I took, economics, I took any kind of political thing I could get my hands on because I just loved it. And then my first job out of college, after waiting tables for a little while, because that was always the first job, but I worked on Capitol Hill in DC, for Congressman Ben Jones,
Oh,
who, if you're old enough, you can remember he was in a sitcom called The Dukes of Hazzard, or a TV show. And so
okay.
he went from TV to Congress. And that can go wrong, but he was actually really smart, and so I learned a lot from him, and I worked on healthcare for him, so I really got into healthcare policy, and, we did all these kind of healthcare open forums, and that's when I really got hooked.
Did he
Um,
have some hook into healthcare, or was that just an area of concern of his, or how?
well, it was during the time that, Hillary Clinton was trying to really reform healthcare, and
Okay.
so there were a lot of town halls, and people just had town halls in their district, and whenever it was time for a town hall, he would go, "Bethy, you like these, come with me." And so we'd go trot and do a little, like, town hall, like, around the state, and I just thought it was fascinating because, health is so important to people. You can't
Mhm.
be productive. You can't be all these other things if your basic health needs aren't being met. And I loved, like, we would go to rural Georgia and then, all over. And I just loved it. So,
Awesome.
that's kind of when I first was like, oh, I really want to do this.
Yeah, and be
Um,
involved in that sector.
yeah, and
You,
CDC would send us up research, like, the CDC was in our district, so we would get lots of research sent up from the
uh,
CDC, and I realized I really don't have enough education to really understand this research. Like, it's really complicated, and so if I'm really gonna do this, I'm gonna have to go back to school and get more education at some point.
okay, and so that's when you went back, got a public health
Mhm.
master's?
I got a master's, and then a couple years later, I got a doctorate.
Oh, you did. Okay, I didn't realize that. That's very, yeah, that's commitment to fully understanding it. And then you subsequently spent 25 years in public health. I mean, it's in the most recent decade, you were contracting with the CDC here in
Mhm.
Atlanta. So talk to us about what you actually did there. Walk us through that. I think a lot of people, um, it's the CDC is this like magical kind of crazy place where these mysterious diseases
Yeah,
are
all
being
the
studied.
viruses are kept.
Yeah, it's like this kind of crazy spot. But talk to us about what you actually did there and kind of the projects you worked on.
Well, first of all, CDC, there's one main campus close to Emory, which is what people think of because that's where the viruses are kept and that's where Ebola is, and but there's also like branches of CDC all over the city. So there's one
Mhm.
in Chamblee. They're everywhere, and so there are lots of parts of CDC, and also most of the money that goes to CDC goes back out to communities. So there are community projects that are funded by CDC everywhere.
Like what?
It's Well, there was one, and I believe this was some CDC money where they were redesigning Fort McPherson, and they wanted to know what kind of designs could be implemented so that healthy communities could be established. So at that point, we were doing consulting on how to turn areas of food deserts into areas where people could buy fresh fruit and produce. And
Okay.
so really kind of practical things of we live in this area, it's a food desert. All that's around are, stop and goes where people get Cinnabons. How do
Mhm.
you change the environment so that a grocery store can be here and can be a viable business? And how do you get a farmer's market? And can you get SNAP benefits at the farmer's market so that people can get double vegetables? So it's like, how do you take this theory of eating fruits and vegetables and getting a lot of exercise and actually implementing it in communities where
Yes.
it sounds a lot easier than it actually is to do things, you know? So it's like that on the ground work of we know what's important for health, but how do you actually make it happen in a community?
And what were some of the gaps that you were seeing? Or what layers of government were you working with? Like, would you work with the Ag Commission or the Agricultural Commission? Or
Yeah.
what? I guess I'm trying to get at like what level, and we're going to get to some of the policymaking stuff, but
Mhm.
I'm just curious about like what layers of government you were working with in that role to get some of these
So
things
it
implemented.
turns out zoning is a lot more important and powerful than I had realized. So
Great
things
point.
have to be zoned a certain way. So,
Hmm.
maybe you can't do a farmer's market. I mean, there's one crazy story with a, a center that I worked at East Point, and they had it was a pre-K center and community. They had a garden in the backyard,
Hmm.
and so the kids were learning about fruits and vegetables, and they were so excited. They'd go home and go, "I got my mom to eat a rutabaga," or all this kind of stuff. So they were changing kind of the way families ate through educating the kids, and then the
Uh-huh.
kids would go home and tell the parents, "I got this new vegetable, here's how we cook it." And so it was this really flourishing thing. And then the garden started to produce more than the families could actually eat. And so one of the kids is like, "Why don't we sell some of our extra produce to people in the neighborhood?" Great, such a cute, I mean, who's not going to buy like,
Right.
vegetables from a kid? Well, so they set it up outside the school and they were just selling very minimal things, but somebody reported them to code enforcement because it wasn't zoned to be okay to sell fruits and vegetables, right? And so it became a huge deal.
Yeah, go
And
on.
all the kids went in front of the city council to say, like, "I just want to sell these tomatoes,"
Yeah.
So they had to do they had to look at the ordinance. It was a huge thing. And they ended up with a compromise. You can't be right in front of the school, but you could set up your farmer's market, at this other place. But all these kind of barriers were set up
Yeah.
for something that seemed like such a good idea, but it hit
Right.
lots of barriers along the way.
It's that
Um,
government bureaucracy getting in the way of like common sense. This should be a no-brainer.
yeah.
But
But
yeah,
it finally ended up where they found a compromise, and these kids, I
that's
was so
great.
impressed with them. They went to the city council and advocated for themselves and, like,
Yeah.
stood up in front of all these grown-ups and explained why this was important, and then lawyers had to get involved and tweak the ord I mean, it was a whole thing.
Yeah.
But, that's just one tiny example of things that it
That's
sounds
a great
like,
one.
"That's a great idea," but when you implement it, it's a lot tougher than it seems like it's gonna be.
Before moving on to the next topic, yeah, I am perpetually amazed by this younger generation that's coming up, the two generations behind us, and it is hopeful.
Yeah.
like the least amount of my emotions towards them. I feel hopeful for them to see their advocacy at work and they're wanting to understand how it all integrates together. So,
Yeah.
very cool to hear that story in particular. Okay, so you've worked in health policy for a long time, but what what's the gap that you kept seeing, like between the science that you were knowing and
Yeah.
understanding and then and like what was happening in the state legislatures. You just gave us a great example on like a super hyper local level,
Mhm.
municipal level almost. um but what's kind of happening with the state legislature and what was happening in public health policy that you were seeing from a Georgia perspective? Any gaps there?
Yeah, that is such a great question. And I mean, I taught at Georgia State for a while and I have a whole lecture on like the difference between scientists and policymakers, which
Okay.
I know we don't have time for here, but the top level is they it's two different worlds really. Like researchers are very methodical. They want to look through every single possibility. They want to explore the nuance. They're not going to say something until they're 100% sure of its accuracy. I mean, these are the rules of science. Policy is often made really quickly,
Mm,
right? The vote is today. Let's go. This bill just dropped. How am I going to vote? And so sometimes it's really hard to integrate the research into that policy timeline because the policymakers need the answers quickly. They're about to
mhm.
take a vote, and researchers sometimes will research 5 or
Years.
10 years before they're
Yeah.
able to say something with confidence. So a lot of it is the timelines aren't lined up, but actually also the language is very different. Like political language is very different than scientific language.
Mhm.
So I like to be that in between person because I can kind of speak both languages. But it's kind of funny when you watch a scientist and a policymaker talk because they're just talking like this,
Over each other.
like the scientists will go, well, the p value of statistically, and the policymaker's like, what? Like, is this good or bad?
Yeah.
Is this
I
going
see
to
it so
help
frequently
people?
with like sales guys and then the
Yeah.
tech team,
Yes.
like everybody's kind of like talking around each other. Anyway, yeah.
Exactly like that, and so you need somebody to step in and go, "What they mean is," and what they
Hmm.
mean is, and because I think research really is an important it can really shine some light on what the impact of this legislation is gonna be, or the unintended consequences of the legislation. I think that science has a really important role, and policymakers sometimes need to be taught how to access it because that's not their world, that's not what they're doing, and it's so interesting to me because scientists usually know one thing very well, they know it deeply. Like, if you study diabetes, if you study anything, you're going to know it in and out. Whereas policymakers have to know so much about so many different topics. And
Right.
so it's also a clash between somebody that has really, really deep knowledge on one thing and other people who have a ton of knowledge across a broad spectrum. And that can be another way that they miss each other. Um,
Yeah.
but both are so important. And I love both of them. So being able to do a job that combines both of those things, it's like my happy place.
A dream place for you
Yeah,
to be.
a big
Yeah, it's
deal.
that
Yeah.
specialist versus generalist thing and
Mhm.
making sure that you do need a liaison many times to get between there. So when you can speak both languages and translate, that's super helpful in the role that you're seeking. Your CDC contract was abruptly terminated, right as
Mhm.
Elon was chainsawing his way through
Yes. Yep.
some of our most impactful agencies globally. So take me back to that moment. It was February, I believe, and that was at the height of what he was kind of doing.
Mhm.
So what happened? Take me back to that time.
Well, I mean, I kind of knew it was coming
Yeah.
down the pike. Like, I wasn't really surprised because I was a contract worker and those contracts are at will. So
Mhm.
I just happened to get renewed every year for 10 years. But every year I knew that they could say, well, this is not how we want to spend our money. But I got happy and lucky that every year they renewed it. Um, so I wasn't surprised, but I was completely like disappointed that it wasn't done in a way of, okay, we need to trim this budget. Let's look at each program and decide, prioritize things or anything like that. It was just across the board
Yeah.
cuts. And so it wasn't really very thoughtful at all.
Because you could probably agree that certain things could be cut. like
Yeah. I mean, there
right,
are inefficiencies in any
every
bureaucracy.
bureaucracy. Yeah.
Yeah, and so I'm sure there are ways that CDC could have modernized a little bit or, could have said, well, our priority is this program. And if we only have this kind of budget, then let's prioritize the one that has, there's lots of things that could have been done. You know, nothing is ever perfect, but the way they did it was just so destructive,
Hmm.
that it didn't seem like it was to improve things. It seemed like it was just to destroy things.
Right.
And my contract, I think, was important because it helped scientists learn how to communicate with policymakers. That's what it was all about. But there were also programs that cut domestic violence survivor support groups and
Mm.
food and vaccines and things that had like direct health impacts for vulnerable populations. And so I was upset about my contract, but the bigger picture was I was very upset about what was happening to our public health system, and it felt like the public health field itself, was being destroyed. And, at its core, public health is to improve people's lives, to improve health outcomes, to improve productivity, to and just to say like, "Oh, none of this matters anymore." Like, was so devastating to people that had committed, their lives to this field.
Nice. Yeah.
So
Yeah.
it was, my part was just a tiny little part in the bigger, just destructive.
Piece of it.
Yeah.
Yeah. Yeah. I mean, the it's frustrating. So to find the words and getting back to my other thoughts, but the Georgia Department of Public Health has even said that the CDC cuts will cost Georgia $334 million in federal funding.
It's
Governor Kemp said that, well, the economy in Georgia, we've consistently broken records and we're sitting on trillions. So, whatever. What's your kind of response to that? I like, is there a disconnect there for you too? Or
well, I feel like when we're in Atlanta, we kind of and, there are parts of Atlanta where there are a lot of communities that are struggling, so I'm not saying it's across the board,
right.
but if Atlanta kinda carries the state in a lot of ways. If you
Mhm.
go South Georgia, you see there's not a lot of economy down there. A lot of the hospitals have closed because we refuse to expand Medicaid, and so the hospitals can no longer afford to stay open because they don't have that Medicaid, revenue, and the health outcomes are terrible. Like, if you took Atlanta out of the mix and just looked at the health outcomes for the rest of the state, like, we're down there. We're at the bottom.
Yeah.
So
Yeah.
it kind of we get a little bit of a skewed view when we drive around Atlanta, and yes, the economy is booming and there's so much happening and all this, and a lot of the rest of the state is really struggling,
Yeah.
with health and with education and with all these things. Um, so I think it's important to look at the big picture, and the fact is that the policies that have been in place are not making people healthier overall. Like we need people to have health insurance. It's very difficult to be healthy without an access to a doctor and medications and all this stuff. Um, so I guess I'm surprised that Georgia is willing to leave so much federal money on the table and you know, not
We're gonna
use
go. And they didn't allocate those additional coffers to public health or insurance. They, in fact, did not expand Medicaid. So it's like,
it.
okay, we also aren't getting that 334 million, and we're also not taking the extra funds to invest in it either. So get double whammy.
Yeah.
And and these programs that are being cut are disproportionately hitting Black Georgians in particular. I mean, HIV research,
Mhm.
tuberculosis, youth violence. It, when you were on the inside prior to the cuts, but did you see a pattern where we were starting to uptick in those areas and focus more on minority public health issues, or was there? I'm just trying to understand like where we were going versus what's probably first to get cut.
Yeah, I mean,
Or
the
were you knowledgeable about any of that? I don't know.
well, a lot of my work was in health equity. So
Oh, okay.
in health disparities. So, a lot of work is in, okay, if you look at health outcomes and the diabetes rates among African American populations are triple what they are around, Caucasian, and I'm making that up.
Yeah.
You have to ask why. You have to look at that because you
Hmm.
don't it's not fair for one population to have a disproportionate burden. That's what we call
Yeah.
it in public health. And, there are lots of reasons beyond that. There could be access to care reasons. It could be like I talked about, the neighborhoods don't have fresh fruits and vegetables. It's a complicated picture. So you kind of look at the whole system and say, what kind of system changes need to happen in order to reduce that disparity and give people the same chance at health? Like
Right.
everyone should be able to live a healthy life. And if there are barriers to that for certain populations, then public health goes in there and tries to understand the barriers and then help remove them if possible. Um, because we really believe that, you know, we are all healthier. If all communities are healthier, that strengthens us as a state. It strengthens us all. So, and then it became where equity was a bad word. We're not supposed to use the word equity. Health disparities was a bad word. So we're not supposed to use the word health disparities.
Did you
And
see that from the inside? Like, was
oh
there
yeah,
like
they would
memorandums and yeah.
they would
Okay.
stri I mean, we would get memos that say, "Please don't use these are a buzzword, like, don't use these
When did
words."
that start?
Ugh, I don't know, it's all kind of
Before
before, yeah,
this? Okay. Okay.
because people knew it was coming, and you were trying to kinda, you know,
Hedge.
yeah, like, don't call attention to yourself right now, let's just see if we can go under
Get
the
through
radar.
this.
Yeah, and so some of it will we would just change the language. I mean, I really think sometimes they probably did, like a search. And if the word equity came up, then oop, that program is gone. You know,
Yeah,
I
no, I
honestly,
believe you.
yeah,
I think that
no,
is exactly what they did.
which sounds insane. That's an insane,
Wildly
yeah,
insane. Yeah.
it's an insane way to make policy.
Ah,
But the problem is it hurts actual people and actual communities.
yeah.
And, you know, there is, there's no way that you can look at this and say race doesn't have something to do with it. Like
Hmm.
we aren't
Hmm.
valuing communities of color
Yeah.
equally. And, like, that just gets me, and I think that we just have to admit that that's part of the whole, uh, program, part of the whole problem.
Yeah, totally get it. Okay, so let's fast forward. Let's get to kind of present day. And
Mhm,
you get a text from a colleague, from a friend saying,
mhm.
want to run for
Oh,
Georgia
yeah,
State House. Not kidding.
yeah, that's funny.
Most people would have laughed and been like, okay, very funny. But what made you seriously consider it? What made you change your mind and say, now's the time?
Well, it took me a little while, and first of all, this friend, she was in a training program learning about political campaigns,
Okay.
and she had been let go from CDC, and so she was learning a lot, and so she sent me this message, and she's a pretty serious person. So, like, other friends, I might have been like, "Oh my god, like, what are they talking?" But I was
Yeah.
like, Stacey wouldn't just say that without like some she's a scientist without some background in there. So I did say like, "Oh, maybe this would be a phone call." Like
Yeah.
let's discuss this over text. But I had to kind of come around to the idea because it is not something I had planned for or thought of. And I was honestly a little bit scared. It seemed like, do I really want to jump into this political world? Do I really want to expose my kids to,
Hmm.
all of this? And so it took me a little while to come around to a yes.
Yeah. Okay.
I was pretty serious about because I knew this was going to change my life and my family and my time with my family and all kinds of things. So um, I never would have thought of it without
That
Casey
nudge.
sending me that text. Yeah.
I mean, I think that's how most people do end up getting into it. It is that nudge from somebody that you know, that you respect, and then all of a sudden you're like, well, if they think that of me, I mean, so your seat that you're running for, a House District 53, has been targeted or moved to a tier one of the most flippable seats in all of Georgia, currently held by a Republican, Deborah Silcox. Um, why do you think this is winnable? Why do you think it is now that we can do this?
Well, it's the only North Atlanta suburb that's in Republican hands. So if you look at a map, a color-coded map, it's all blue except for this one area that goes from Roswell all the way down Sandy Springs, all the way to Buckhead through the governor's mansion, all the way down to Buckhead. And it went for Kamala Harris, the district did,
Hmm.
in 2024. So I think there are a lot of Democrats in the district and there are a lot of independents in the district. And there are a lot of Republicans too that have always considered themselves Republicans, but now they look at the Republican Party and think, what is that party? That's not the party that I think that I'm a part of and that I've been a part of my whole life. And I've had coffee with a lot of people that kind of fall into all of those categories. And so I think that if we run a campaign where it's like, I'm a public health person, so I like effective policies. I like things that are based in science. I like things that are practical. And we're going to do things that are what the district values, but in a practical way that shows positive outcomes. I feel like a lot of people can buy into that and come to the table. And um, there are certain issues that people in the district really care about that are not being reflected accurately in the current representatives voting pattern. And so there's just a lot of good indication that it's time for a
New
switch.
leadership.
Hmm.
Speaking of her voting pattern, she's missed multiple key votes: the 6-week abortion ban, Medicaid expansion, the gun silencer regulations. What does it tell you about a representative when they're not in the room for the hardest votes? And this is a key thing that people on both sides of the aisle will do. So I'm not just calling her out. I will call her out because she did miss key votes, and I think that your job is to be representative for those key votes for all of
Hmm.
you. Um, but it does happen
Hmm.
on the Democratic side just as well. But what does it say to you about any representative when they're not in the room for those votes?
Well, I think that's what their job is, right? Your job is to take the votes and to represent your district. And if you're not willing to do that, then I think you're not doing a major part of your job. You're not doing what people sent you there to do. Now, that being said, I also know that the Republican caucus in the House um, is will strong arm people
Mm.
into voting the way that they want to vote. And so
I mean,
a
they won't
lot of
even let things get out of committee.
yeah, they got a tight hold on it, and so to be able to stand up against the Republican caucus and say, "My district wants me to vote this way, even though the caucus is pushing me this way," that takes a lot of courage and a lot of boldness, and, some people don't wanna rock the boat. They would rather just fall in line and you know, do what the party's telling them to do, and it's just easier that way, and so it's easier to kind of leave than take a stand of, "I'm gonna
Mhm.
vote the way my district wants me to vote,"
Yeah.
and so
Yep.
I think leaving to me is kind of a cop out,
Cowardice
if
in
to
a
be
way.
honest,
Yeah.
and especially when we've got these important, I mean, access to guns and children, like, getting a hold of weapons and
Life threatening.
yeah, I mean, kids are dying,
Yeah.
and so it's you gotta stay like, we've gotta be the grown-ups, and so if it makes you uncomfortable, tough, like, get up and take the vote,
Yep.
and we are as grown-ups, we're the ones that should be uncomfortable,
Yep.
not kids, and, I mean, that's one thing that I can like, I almost start crying when I think about, like, what we ask our children to do, like, go to school, participate in the shooter drill, like, we're just asking our kids so much, and it's up to us to make the necessary changes,
And
and
stand on
so
our
yeah,
ground, back our
yeah.
business. And you do have a primary opponent, and I'm going to get
Mhm,
into an area. I'm going to get into this, and I fully recognize that you may not want to answer or say anything, but I do want to talk about it because you do have another Democratic candidate in this race, in this primary. His name is Tim Dorr, and he's a tech entrepreneur. I want to be direct with listeners that there is a documented public record about him at timdorforgeorgia.com. And I think that Democratic voters in this district, or that know people in this district, should know about that before going into this primary May 19th and early voting starting even sooner. And he spent years talking about affordability while living in a 3 point, almost $4 million estate in Buckhead. The website has now surfaced photos that he has published himself that have been on his social media for nearly 20 years, including one of them self-posing as an Iraqi insurgent. He's got another of a friend in blackface. He captioned and curated. These are all captioned and curated by him. There's other misogynistic, homophobic, and negative content, as well as negative references to the Obamas. A lot of people would probably, that this was discovered about and are running for office, would take accountability or responsibility and try to youthful indiscretions it. He has not done that. In fact, he's fought it instead of taking accountability. And I I just say all that to say it, one, so that the public is aware. But do you have any thoughts or commentary on any of this? Do you? And like, if you'd rather not speak to his record, I completely understand. Like, I get that, but I thought I'd give you an opportunity to address that if you wanted to.
Yeah, I've really been focused on myself and my campaign and, what I want to do for this district. So I have not made any comments on that.
Mhm.
And, I all I can say is that where I come, the way I approach things is I value um, all communities, all people, all races, all genders, and I'm just working to how do we create policies that support all communities. And so that's who I am.
Mhm.
And I'm going to kind of let him be who he is, and I'll be who I am. And I hope that, the primary is supposed to bring forth the strongest candidate to just face in the opponent in the general election. And so I'm trusting that this primary, will do that. And I hope that the voters will pick me to do the very serious challenge of taking on the Republican and flipping the seat so that we can put another Democratic voice under the dome, because I think that's a crucial thing. So my
Right.
focus is really on moving forward to that and to accomplishing that goal of flipping the seat.
I think that's commendable, and I also just both to put a really fine point on it. We have an opportunity to flip this district. This is our, as I've already stated, this is one where we can, it is a top tier seat. It is looked at as one of the most competitive, and our ability to flip it and to have candidates at this moment in time, at this specific moment in our political history, where we are coming to a head and holding people accountable. I mean, we've just seen multiple legislators within the last 2 weeks be called out on both sides of the aisle for their misconduct and misbehavior. That we, as an electing body, are putting forward the people. Like, I am so far removed from wanting to cancel people, and I don't even think that this is like cancelable on his part. I'm not trying to say that this material is, but when we are at the precipice of such a seriously pivotal time, it is important on us as voters to really be paying attention and making these decisions, especially at the primary time, and making our voices heard on what we want our elected leadership to be in the fall. So, this is something that we can do, and I feel like voters should recognize that sometimes there's still some egos with some people on not wanting the betterment for all and kind of wanting their own agenda. So I'll leave it at that. Um, before we start, I'm going to start wrapping this up here, but you left a career that you loved, an institution you believed in, and it was kind of like ripped away from you. But instead of walking away from public service, you're deciding to go deeper and stay involved. So you mentioned you were like, it took me a while to get there.
Mhm.
Was there an inflection point? What was that for you?
I think talking to my family,
Mhm.
I talked to my son Timothy, who's 16, and I asked him and I say, "Well, I've been approached to do this thing. I'm being recruited and, what do you think about it?" And he, without hesitating, he goes, "You should do it." And I said, "Oh, okay, why?" And he said, "Mom, you're like a decent person." And first of all, I was like, "Oh my God, you think I'm decent?"
Yeah.
Because 16-year-old boys don't often share
Yeah.
that,
You
you know?
like me.
"Hey, you like me, yay, hey, Mikey." So anyway, I was like, and then he goes, and then I thought when he was talking, I said, our politics have gotten so negative and so just that a 16-year-old boy is saying what we need is decency, you know?
Mhm.
And he's been very like, "Mom, you make sure you talk to everybody and don't discount people." And I said, "I understand." And so he totally bought in. So I was like, "Okay, good with that." And then I talked to my husband and I listed all the things I shouldn't do. Like I don't want to expose the kids. And what if, I come off against, I take on the gun lobby and, people put flyers in our mail because it's a big deal.
Yeah.
And I said, "What if I'm exposing the kids to stuff?" And he looked at me and he said, "What you're going to be exposing your kids to is the knowledge that their mother draws a line in the sand and says, 'No, I don't want our society to keep going down this direction. So we got to right this ship.'"
Yeah.
And I was like, "Oh no, I think I'm running," because it is true that it's like I want my kids to grow up in a society that has the values that I grew up with, which is three branches of government. We're all created equal. Everyone has a right to practice their own religion or not practice. Every faith should be, and so I really feel like, when I'm 90 years old or whatever, I can look back and be proud of, yes, I had an opportunity to try to make some changes, to try to, um, create a world that I want my kids to be able to live in. And, I I don't have any I know it might be incremental changes and I don't have any kind of like Pollyanna idea about it, but I just feel like we all have our part to play in creating the kind of society that we want and we want our kids to have. And it looks like for right now, this is the part that I can play. And so I'm going to play it and I'm going to play it to the best of my ability. And what has been so encouraging is that there are so many people out there who are also doing what they can. And together, we're building a really strong kind of movement. And I'm honored to be part of the movement.
Yeah.
So I just see myself as a little piece of this big thing that's happening. And so many people are working hard to create a world for that we want our kids to be able to grow up in. And so that's my main why of why I'm doing it.
It has been at a time that can affect so many negatively, focusing on the top. Our little neck of the woods here in Georgia, and like to see the connections being made, the progress being made, and like knowing how many good people are in the fight to try to
Mhm,
sh change the ship from this level. Knowing they can't do a lot up here at the top of craziness, but
mhm.
it's been exceptionally heartwarming and hopeful during this time. So, all right. So, thank you very much. That hard part's over. Now we're going to go to the lightning round. I got a few
Oh,
lightning round questions,
okay.
and then we'll wrap this up. Braves, Falcons, or Atlanta United?
Oh, which game do I like?
Right.
I'm gonna say Hawks.
Oh, I'd left out the Hawks. Good on you.
I
Okay.
love basketball. I love watching Hawks.
Okay, thank you very much. I cannot, people are going to ream me for that. Friends and all. Uh, Favorite spot on the Chattahoochee and why?
Mm. Oh gosh, there's so many pretty parts. I really like the place in Morgan Falls where you can put the kayaks in.
Mm-hmm.
And we've gone out there. We on Mother's Day we tend to go get some kayaks and do a family kayak. So I love that. And when I was little, we would raft down the Chattahoochee, and
Yes.
so that's another thing that like I love doing with my kids because I can remember when I did it with my parents. So
Nostalgia.
yeah.
Last book or that you read or are reading right now?
Oh my gosh. Oh, I am so bad with books. Right now, my reading is all focused on policy briefs. So ask me. I hope that this summer I'll be able to pick up a beach read, but right now I'm reading policy. I know
That's
that's not that
excellent.
fun, but that's true.
That's awesome. Favorite Southern or Georgia dish?
My grandmother used to make this sweet potato dish with marshmallows on top,
Yeah. Okay.
and so that is my childhood memory favorite dish. Um, we tend to have a lot of like salmon, and I really like shrimp and grits too.
Yeah, shrimp grits is a great one.
Mhm.
You spent 25 years in public health. Give me one piece of advice that most people completely ignore.
Oh my gosh, get enough sleep.
Oh, that's a great
No,
one.
sleep is a key part of health, and, I mean, I did a huge thing on, like, what it does to your brain when you don't get enough sleep, and so sleep, 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 and
Excellent.
if you don't feel guilty about taking a nap, if your body needs it, it's good for you.
Just do it.
Mhm.
Last but not least, where can people find you?
Oh, Beth Fuller for Georgia.com, all spelled out,
Okay.
and, I'm on Instagram too, and I don't know it's Beth I don't know what it is.
Just Google
Yes.
or search.
It's on the website too, but I have not been a social media person, so this is all new for me.
Yeah,
Yeah, but it's actually fun to catch up and see what everybody's doing, so now I kinda like it.
it
But
is.
I'm on Instagram, Facebook, and I have a website.
Wonderful, Beth. Thank you so much for joining us today. And
Thank you
thank
for
you to
having
all
me.
that listened this far. I'm so glad that you joined us and listened to this episode of Appen Media's Georgia Politics podcast. Until next time, thanks so much.
Thank you, Lindsay.
Thank you.